Hi, Dr. Arland Hill here back with you today, and today we need to talk about how to get the most out of micronutrient testing by utilizing it as a diagnostic tool, as a predictive tool, and also as a therapeutic intervention. Now, compare this to most laboratory testing. Most laboratory testing are going to be considered diagnostic. They're generally pointing to either a specific system in the body that needs attention, or they're typically looking at, for example, an anemia. They're really giving you an idea of what's wrong with that individual, where the attention needs to focus in any subsequent therapies that you may implement with that individual. But that's only one aspect of how we should look at a micronutrient test. And in fact, when we're looking at micronutrients as a diagnostic tool, let me just expound on that. Essentially what we're doing here is we're looking at the nutrient deficiency to give us more insight. We're looking at that deficiency as a way of understanding at a deeper level what's going on with that patient. For example, if they have a B12 deficiency, that may give us insight into that there are potentially methylation deficits. There may be some neurological implications with that individual, and another scenario may be that there's impaired detoxification. It really just depends on whether you want to look at it from more of a conventional model or more of a functional model as to what that diagnostic indicator may be. But as valuable as that is, as important as it is to know what that nutrient deficiency, what those core nutrient deficiencies are for that individual, it's also very important to understand the predictive and the therapeutic nature. Now, for the most part, when we talk about testing, we don't typically look at any type of testing from a predictive standpoint. But you may be interested to know and understand that when we talk about nutrients, nutrients understand are components to our biochemistry, and therefore if we have deficiencies in nutrients, then there are certain things that we begin to understand are going to become dysfunctional, and as a byproduct of that, we may in turn see disease manifest as an extension. Let me give two examples to further highlight what I'm talking about here. We know that vitamin D has numerous roles throughout the body, but we appreciate now that when it comes to vitamin D, that we see vitamin D being talked about as an anti-diabetic intervention. And what this means is that for individuals that have vitamin D deficiencies, we understand that there's going to be a point in which that individual is going to develop some degree of dysglycemia, some degree of insulin resistance most likely as a byproduct of that vitamin D deficiency. But again, this is a manifestation of that vitamin D not being adequate, and those impaired pathways allow us to give that predictive insight. Now, I said I would give you two examples here, so let me share another one with you. Individuals with B12 deficiencies, and B12 deficiencies manifest for a number of different reasons, whether that be as a byproduct of lack of intake in the diet, poor utilization, maybe it's because of an H. pylori infection. There are a number of ways, and I'll get into some of these in some other videos that I'm gonna do for you here. But I want to share with you that when you have a B12 deficiency, we know that as a byproduct of that, it causes an elevation in homocysteine. And that elevation in homocysteine, especially when coupled with a folate deficiency, is going to lead to mild cognitive impairment and maybe on into some other more advanced neurodegenerative state. So take this information and think about how to apply this with a patient. When you're in the consultation with that patient and you're going through those results, not only are you sharing with that individual specifically what deficiencies they have, you also are giving that individual insight into what the implications are for them if they don't correct these deficiencies. It's more than simply fatigue or some temporary brain fog. There's a much bigger picture that with the research evidence backing behind the statements that we're able to make, we can confidently say that we are able to predict. And we may also think about this in a different terms of future occurrence. The future occurrence of a state of dysfunction or even a disease is much greater when we see a vitamin deficiency or a nutrient deficiency present, not just vitamins, but all nutrients. Now, that takes care of diagnostic and predictive. What about therapeutic? Therapeutic is just essentially what it is. It is allowing us to go in and not just use that marker, not just to use that analyte as a diagnostic indication for what's going wrong with that individual, but it's also allowing us to see exactly what therapies and interventions are going to be most important and best utilized for that individual. If we see a coenzyme Q10 deficiency, we're not going to be giving that individual B1 or B12 or magnesium. No, we are specifically giving them coenzyme Q10. And also take note on this. Remember, we don't want to just look at these as single nutrient repletions. From a therapeutic standpoint, we want to look at the bigger picture and use that diagnostic information to come up with a therapeutic cocktail that is going to be most specific to that individual to address their individual needs. So think about as you're going through these reports with patients and how do you utilize this information of diagnostic, predictive, therapeutic? Well, the way that this is laid out is we want to help the patient understand what nutrient deficiencies are directly correlating to their symptoms. So that in turn is the diagnostic component to this. We want to see from a predictive standpoint, we want the patient to understand what the longer term implications are of having that nutrient deficiency, but also not correcting that nutrient deficiency. And then we want to use this information to help the patient understand how we're going to specifically set up a treatment protocol just for them. So apply the diagnostic, predictive, and therapeutic intervention or concepts with your consultations and with your reporting. And at the end of the day, you'll have a patient who is more on board and more likely to be compliant with the recommendations that you're going to make.